Hi, good afternoon, everybody. Welcome to the Electronic Visit Verification public meeting hosted by DHS. Just some general guidance for today's public meeting and reminders. All phone lines are muted today. Any questions that you have throughout the presentation should be submitted through the chat feature. I will not be answering submitted questions during today's presentation, but the questions that are submitted should be addressed after the presentation through updates to the FAQs that are posted on the DHS EVV website. You will notice that the FAQs have not been updated yet. We do have a considerable number of updates. We're waiting on our communications office to make those updates. They should be in place either later today or first thing next week. As far as the answers to questions today, those should be up within the next several weeks. So just make sure that you are checking those FAQs on the DHS EVV website. And then when you are submitting your questions, please reference the slide number if applicable, just so that we know exactly what you're referring to. So with that, our agenda is pretty lengthy today. We're going to talk about Alt EVV recertification, certification. We're going to do some Alt EVV reminders. We'll talk a little bit about some updates related to home healthcare services EVV implementation, because as we all know, that date for implementation is quickly coming upon us. EVV personal care services reminders and some EVV PCS system updates. We'll talk a little bit about the EVV PCS manual edit compliance. HHA Exchange will be providing a few updates, and then we'll also go through our EVV contacts. So with that, the top of the hour is alternate EVV recertification. We wanted this first and foremost, since this is our #1 concern at this point. For vendor recertification, these are vendors who were previously certified in the Personal Care Services EVV program. Those vendors should have received an email from the PA Alt EVV support team detailing the process to recertify. But there's also the reference guide, the quick reference guide that is on the DHS website, and you'll see the direct link to the Alt EVV website here. We also have a screenshot of what that recertification step and quick reference guide looks like. As of today, we have 16 alternate EVV vendors that are recertified with SANDATA. And we've included that list here for any of you that are on just by phone. That list consists of MITC, JuliSoft, AssuraCare, SwiftOps, Unicentric, Brightstar, MatrixCare, ERSP, Cyberwolf, Kaleidoscope, Central Reach, Therap, Careficient, MedSys, Allura, and KDG. So if your Alt EVV vendor is not included on that list, and you are a provider that uses an Alt EVV vendor that is not on that list, again, you want to check the status of your recertification to see where they are in the process, because we do have an outstanding number of vendors that have not completed the recertification process. And just a reminder that alternate EVV vendors need to be recertified by August 10th of 2022, so less than 2 months from today. If not, the personal care services claims will deny beginning August 10th, 2022. Included here on this slide is a list of vendors that are pending their testing checklists. So these are the vendors that we are the most concerned with at this point to ensure that they are recertified by August 10th. So if you have one of these vendors, please make sure that you are in contact with them and that they are then doing their part to recertify by August 10th. So the majority of alternate EVV vendors requiring recertification are in step 3 of the recertification process. That step in the process is where they conduct self-paced testing, and the Pennsylvania alternate EVV support team assists with any issues or errors that are encountered. This is definitely the lengthiest of all the recertification process steps and is generally anticipated to take between 2 to 4 weeks. Of course, that length of time is dependent upon the vendor system, and or the level of engagement by the vendor. So vendors should be monitoring emails regularly. And again, if you are a provider that uses one of those alternate EVV systems that is kind of stuck in the process, I would make sure that you reach out to them and ensure that they are moving forward in the process. We also wanted to make sure that folks understand that of those recertified alternate EVV vendors, we are seeing some issues with the modifiers not being included. So while the vendor has passed and is recertified, so they did submit or are submitting a null value in the modifier field, if a service being rendered has a modifier, the modifier really needs to be included on the visit data. So next we'll talk about alternate EVV certification. So this is for any new alternate EVV vendors to the DHS EVV program. So for new vendor certification, again, these were vendors that have not previously certified with our program. They have a different pathway, and they need to have at least one Pennsylvania provider agency client in order to go through the certification process with the Pennsylvania alternate EVV support team. There is a reference guide, a quick reference guide specific to new vendors on our DHS website. So that is the quick reference guide that you would want to, access and review. The alternate EVV certification duration is 2 to 4 weeks for recertifications, but it's 2 to 6 weeks for new vendor certifications. Testing should continue until the data sent is error-free, and then once testing is complete, DHS encourages vendors and agencies to take the time to meet to ensure the data is accurate in the DHS aggregator. If you are a provider using both alternate EVV and DHS EVV systems, please let Sandan know that by contacting the Pennsylvania Alternate EVV support team by phone at 855-705-2407 or by email at paaltevv@sandata.com. So this is really, really important. We can't drive this home enough that all vendors are required to certify or recertify for both personal care services and home health care services programs. There will be no exemptions for recertifications. And there are new requirements for both personal care services and home health care services programs. We'll go through some of those in later slides, but there are some new requirements, and those are identified in the tech specs. A vendor's failure to complete the certification or recertification process will risk full file rejections once those new requirements are enforced. And we at DHS are targeting to enforce these requirements effective August 10th, 2022. With that, I will turn it over to Janice for alternate EVV reminders.
Okay, thank you, Britt. This is Janice Bickle with the Office of Long-Term Living, ready to share some alt EVV reminders. So just to remember that some integration best practices are to first send your clients or members records first, and then send your employee or caregiver records second. Third, you should send your visits once the clients and the employees have loaded. And then our fourth step is continue to send visits on your defined schedule. Fifth, you should send new clients as they are created or an existing record is updated. And sixth, send new employees as they are created or an existing record is updated. The alternate EVV technical specifications have been consolidated to a single specification for the Pennsylvania DHS alternate EVV submissions. So whereas before we had multiple addendums, it is down to one technical specification for all EVV. The Pennsylvania DHS all EVV technical specifications encompasses all payer programs through DHS. The alternate EVV technical specifications for the Department of Human Services EVV programs are available on our DHS EVV website. And that could be, oh, it's on the slide. If you download the slides, you'll be able to find it. We can go to the next slide. Thank you. Okay, this is important. There is a new requirement and a new required field for call segments. It has a new field at visit location type, which specifies the place of the service rendered by caregivers as either home or community. This is required for all call types, including mobile, telephony, FVV, as well as manual.
Janice, this is Janelle. I just wanted to add for clarity that the expected value, we've had a question about this in the past, is actually the numerical value. So in that field, the vendor would submit a 1, right, designating home, or 2, designated community. Thank you.
Wonderful. Thank you so much, Janelle. We can go to the next slide. Okay, other new information. Just a reminder that other is no longer considered a valid call type and call assignment in the PADHS EVV program. A valid call type is mobile, telephony, FVV, and manual. A valid call assignment is time in or time out. New FVV for calls segment associated with call type of FVV has the conditional call latitude and call longitude fields will now become required fields. The following existing logic is within the system. In the mobile system, for call segment associated with call type of mobile, the conditional call latitude and call longitude fields will now become required fields. For telephony, for call segment associated with call type of telephony, the conditional originating phone number and telephony PIN fields are now going to be required fields. We can go to the next one. New personal care or no physical health choices and community health choices payer program codes are going to become available on or after August 10th of 2022. And these are specific to the MCO for personal care services or home health care services. The exception for this is T1019, which can be accepted currently. It's very important to know that alternate EVV submitters cannot use the new physical health choices and community health choices payer program codes until August 10th of 2022. The old physical health choices and community health choices payer program codes will no longer be accepted after December 31st of 2022. So providers want to make sure that all EVV vendors are up to date on this and implementing accordingly. Next slide. So now we have some EVV reminders in a question and answer format. So we received the question from a lot of entities asking, there are some instances between the current spec and the new spec where the order of the segments are switched. And updated information for that is having the order match what is currently in the spec as opposed to the new spec will not lead to a rejection. So if you're seeing things out of order, that is okay. It will not lead to a rejection in the system. Our next question is, will existing providers, such as providers already doing EVV for personal care services, receive new credentials to replace their original production credentials? And the answer to that is existing provider login values in production will not change. So you don't need to update anything. So another question we've received is, do all EVV vendors have to test for each agency account in order to pass certification? And the answer to that is no. Vendors can pass certification by testing successfully with one agency account. But you want to keep all your agencies aware that you did pass credentialing. So more reminders. We received the question, Sandata sent out test Medicaid IDs, but not NPIs. So it's not possible to test the procedure code and the NPI combination accurately. And the information we have from the department about that is you are able to substitute the Medicaid ID or the MPI in for the NPI number. If you require a 10-digit ID to test, please request it in your testing support ticket, and the representative will provide one for you. Another question we've received is if vendors and providers are currently using 5-digit social security numbers as the employee identifier, or the last 5 digits of an employee's social security number as the employee identifier, and then you decide to move to format 1 or 2, how do we do that? The answer to that one is you are able to change at any time. However, you will need to send all employees with the new ID. Additionally, all existing visits needing changes will still need to be done using the former employee ID unless you choose to omit the visit and send it again with the new employee ID. And some additional reminders for all EVV vendors and providers. Sandata has held 2 alternate EVV town hall events for the Pennsylvania DHS program. Vendors, providers, and MCOs were all encouraged to attend these events. Both sessions were recorded and they are available on the DHS EVV website under EVV public meetings. And there's a link in our slideshow if you want to click on it, and it will take you right to the recordings. Okay, our last one is be sure to review the alternate EVV technical specifications and the quick reference guide vendor credentialing documents on our DHS EVV website. And the Sandata alternate EVV error handling overview and reference guide has been updated as of March of 2022, and that is also available on the PADHS EVV website.
All right, general updates, general EVV program updates. Well, if you're a new provider, these next couple slides are for you. So if you're a new provider to the DHS EVV program, please go to the DHS alternate EVV webpage to fill out the DHS Home Health alternate EVV new provider registration form. There you see the link, so you can just copy it or just click on the link in the PowerPoint and go right to it. This form is going to initiate your agency receiving credentials to the DHS aggregator. Once completed, you will receive an email response providing your agency with the next steps to receiving your agency credentials. Please make sure to use a unique email address for each new provider registration. Again, make sure it's a good email address and make sure it's the person that's going to be doing EVV within your agency. Okay, next slide, please.
Chuck, could I intervene real quick?
Yes.
I wanted to add something. Thank you. Could we go back a slide? Just wanted to clarify, we do have some contacts who support multiple provider agencies and have been listed as the contact with the same email address for every agency. So that last bullet is to clarify if you're in that situation. Again, we're looking for a unique, distinct email address for each provider registration. Thank you.
Great, thank you, Janelle. New provider accounts are currently delayed. So it is anticipated that SANDATA should be able to create new agency accounts starting in August 2022. New home health care services, fee-for-service providers who have completed and submitted the DHS home health alternate EVV new provider registration form by the DHS alternate EVV webpage and have questions specific to the alternate EVV can contact the PA alternate EVV support team. There you have the phone number 855-705-2407 and concurrently the email address there for you to email. Next slide. All right, and when filling a ticket with PA alternate EVV support team, please copy the PA DHS EVV issue resource account. By doing so, PA DHS, that'll be us, will be aware of the issues vendors are experiencing. So please make sure you are CCing us on that email address so we know what's going on as well. All right, next slide, please. All right. The DHS aggregator has a read-only view and reporting to help you monitor all the visits your vendor delivered for both PCS and HSCS services. DHS aggregator compiles the visit data for provider agencies to review. The DHS aggregator does not submit claims. The DHS aggregator is validated against during claim processing when an EVV service is found on the claims transaction. Billing processes continue as normal. All right, we're going to turn it over to Ellie.
Thanks, Chuck. And we're going to look at the Home Health Care Services EVV implementation now. The 21st Century Cures Act mandated that states implement EVV for home health care services by January 1st, 2023. The department intends to provide a soft launch period targeted to start August 10th, 2022. During soft launch, Home Health Care Services EVV error status codes will set in a pay and list disposition prior to January 1st, 2023. For claims that contain home health care services during this time, MMIS will perform validation against the EVV aggregator to determine if the information submitted on the claim matches the EVV PCS visit data stored in the EVV aggregator. However, EVV error status codes will set without impacting claim payment. During this period, the claim will continue to successfully pass DHS EVV validation and process through the normal claims adjudication process. The hard launch date for Home Health Care Services EVV implementation is January 1st, 2023. As of January 1st, 2023, Home Health Care Services claims will deny for lack of a matching EVV visit record at the time of claims processing. As of January 1st, 2023, Home Health Care Services claim denials will begin for EVV ESCs. ESC 935 EVV Home Health Care Services Visit Verified, ESC 937 Home Health Care Services Unit Build Exceed Units Verified in EVV, and ESC 938 No Matching EVV Home Health Care Services Visit Found. A pending change, PADHS is targeting to establish new EVV ESCs, one for PCS and one for home health care services, to identify those service details denying due to duplicate visit records in the EVV aggregator. DHS intends to apply for the good faith effort extension for home health care services EVV implementation. If approved by CMS, the extension would allow for up to an additional year for home health care services EVV implementation. This extension, if granted, will not impact PCS EVV implementation. This does not impact the soft launch start date, which is currently slated for August 10th, 2022. The year extension would provide additional time for the soft launch with impact to claims then beginning January 1st, 2024. The department published a list of Medicaid state plan and waiver services identified as home health care services that are subject to EVV. This list is available on the DHS EVV webpage. Home health care service requirements are anticipated to be provided in an MA bulletin targeted for issue by August 2022. And home health care service providers need to determine whether to use the DHS EVV solution or their own alternate EVV system. Technical specifications for alternate EVV providers are now available and have been posted to the DHS EVV website. Alternate EVV vendors for PCS may also be able to support home health care services. Home health care service providers who also provide personal care services should work with their vendors to integrate for the home health care services implementation. And now Paul will continue.
Thanks, Ellie. I'm going to speak to the free DHS EVV system. I do want to make a quick note. I know that one of the questions was about Horizon, the vendor. I just want to confirm from the San Diego side that we do have Horizon as a certified or recertified vendor. They were just omitted on the list, so we do apologize, but they are recertified. So now going into the free DHS EVV system implementation. If you're going to be planning on using the DHS EVV system, providers are going to need to complete that training and then receive those login credentials. The free DHS EVV system is available for use for the fee-for-service providers only. This includes the ODP, the OMAP, the OLTL, and this includes also both the PCS as well as home healthcare services. So again, only fee-for-service, ODP, OMAP, and OLTL. For PCS and HHCS, you are not going to be able to submit visits for any of the MCOs using this the DHS EVV. The free DHS EVV system cannot capture visits, as I mentioned, for any of the MCOs. If you have a question about those MCOs, please contact an appropriate Health Choices or Community Health Choices MCO for ways to process those EVV visits. If you do use an alternate EVV vendor, then you do not need to take this training. Again, this is only for those people that are needing the free DHS EVV system. Next slide, please. Thank you. So the training for the home healthcare agencies opting to use the free DHS EVV system will begin on August 20th. There are several choices of options for your training. If you are someone who prefers face-to-face in-person type of training, there are going to be 3 days of in-person classroom sessions for the administrators of the agencies. Then there's also going to be the option for instructor-led webinar sessions for staff as well as the administrators. And then self-paced training, which is accessible 24/7, delivered via the San Diego Learning Management System. And I'm going to correct that. That's the self-paced training accessible on the is actually going to be on the San Data On Demand. It's not going to be on the LMS. So it's all going to be on the San Data On Demand. The LMS system will only house the administration and security features. So we'll correct that and get that sent back out again. So self-paced training will be accessible on San Data On Demand only. Next slide, please. In-person training sessions are a full day and will be held at Harrisburg University in Harrisburg, Pennsylvania on August 16th, 17th, and 18th. The webinar sessions will be offered August 22nd through August 30th, 2020. Again, note, prior to home health care launch, agencies will be receiving communications regarding the DHS EVV system training with all the pertinent webinar center links, as well as dates, times, and locations of those in-person training sessions. Next slide, please. Agency administrators, again, for the home health care services only, should wait until August 10th to access and take the San Data Learning Management System training. It's important to note that home health care services only providers should I'm sorry, excuse me. So it's important to note that the current training that's in the LMS right now is only for PCS services. So if you go online and you see that there's the LMS training, you can go ahead and take it. However, it's not going to qualify you to receive your credentials. You'll still need to go back in later on and take the LMS training that is for security purposes and administrators only. So again, administrators, if you do take the training now, that's fine, but you will still need to take the training again after August 10th to qualify for your credentials. So steps for completing the EVV training. Agency administrators will need to complete the 2 required courses, which is an overview and security course. That's going to be in the LMS system, as I mentioned on the previous slide. The LMS registration link will be provided in future communications. After the agency administrator has completed the required courses, they will receive an automated email, which will contain the links to the SANDATA Webinar Center and SANDATA On Demand for other trainings if you would like. The Webinar Center is at onehub.com. Which will provide a listing of all the instructor-led courses and role-based webinars for your agency staff. Then, of course, SANDATA On Demand with the SANDATA Zendesk link in the slide deck, which contains a full range of recorded self-paced video snippets on EVV functionality for staff to review. So once the updated training has been activated, and you've completed your training 48 to 72 hours upon completion of those 2 security courses, the first agency administrator who does take that course. So again, if 2 people do take the training for the security administrator course, the first person that took the training will end up receiving those production credentials, those provider agency credentials. So again, if 2 people do go in and you have 2 administrators take the security administration courses, the first person and only the first person will receive an email with those credentials. The agency credentials are delivered in a welcome kit to the email, to the user's registered email in the LMS system. Again, so it's the email that was used for the LMS in the LMS system, not the one that's in Promise. So, and you'll only receive 1 set of credentials and they're delivered per agency. The credentials are delivered via a secure email. And again, because it does go to go through a secure email server, sometimes they do end up in junk mail. So please make sure you're checking your spam and junk folders. Partial contents of the welcome kit email are encrypted, as we mentioned, and it comes to that send safely email. When the welcome kit email is sent by the SANDATA, the recipient will be able to open it up in 10 days. After 10 days, that link expires. So again, you have 10 days to open it. Once that 10 days is up, that link will expire and you will have to request a new link. Once open, the recipient does have 10 minutes to access the code to open the secure contents. So again, once you start to open it up, you only have 10 minutes. Again, we want to emphasize security. So that's why we put these secure measures in to make sure, again, that we're keeping everything, safe for your agency. So again, you've got 10 days to open the email, and then you've got 10 minutes to open up and access the code to secure those contents. So again, it's very, very important to open up your welcome kit email timely to avoid any requests to have to go back to the support desk and ask them for a link to be resent to you. So in the welcome kit email, again, we refer to it as a welcome kit. It's basically an email that contains several contents in there. First is an encrypted welcome letter that contains important next steps instructions for using your EVV, including agency-specific login credentials, the URL for where you're going to be able to go to log into the EVV, the username, and the temporary password. And of course, again, it gives you the access to the SANDATA EVV database. A couple things there on the username. The username is the email in the Promise system. So whether it's right or wrong in the Promise system, that's what's provided to the system, and the system creates that username based off of the Promise email. So again, it's not the same email that you use for training, or if it is the same email that you've used for training, then that'll be fine. But again, if you use a different email than what's in Promise for the training, again, just be aware that that username email will be the one that links to Promise. Login credentials then contained in that welcome kit will also allow the agency to input their direct care workers, as well as set up any additional agency level staff members to view and manage the EVV data. These temporary credentials then are created using the email that is registered in Promise. And I'm jumping ahead, telling you some things before I get to them in the bullet points. But again, there it is. Again, note that if that email is wrong in Promise, that's okay. Just use that email to open up that welcome kit and then reset it with Promise later on. Two agency-specific call reference guides. Two agency-specific call reference guides are also included in your welcome kit. These contain the Santrax toll-free phone numbers. You'll receive 2 toll-free phone numbers with your welcome kit. Those are to be used for your TVV call-ins. Okay, so one is for group visits, and then one is for non-group visits. So there are service codes that are for single recipients, and then there's one call reference guide for group visits. CRGs contain step-by-step instructions for the direct care workers on how to check in and out using the telephony system. And the last is a PA service list. Please always check the PADHS website for updates to this service list. And that service list is a reference guide to be used with the TVB system so that you know what prompts to use when you're typing in on the phone for TVB. So it'll show you a number, maybe 123 is the code that you type in for W1726. Again, I'm just giving a reference here. That's not the exact code to type in for W1726, but you type it on the phone, 123, and then it would bring up 1726 in the system for you. While multiple provider representatives from the same agency may complete the EVV training, the welcome kit again will be mailed to the first identified provider agency representative email address on the training registration and completion reports. When their agencies receive their welcome kit emails, they should begin to data enter direct care workers into the free DHS EVV system, add agency EVV users, add clients, and become familiar with training documents and train their agency employees. Again, as soon as you get it, don't wait. Start inputting all the information that you can that may not be coming through the provider feeds and the client feeds and the member feeds and so on. So whatever data you can put in there, whatever user permissions you want to put into the system, the employees' names and so on, please start doing that immediately. Thank you. Training agency administrators using the free DHS EVV system delivered via in-person and classroom sessions. These are the training topics, okay? So we're going to talk about client employee authorizations, scheduling, visit capture, visit maintenance, again, group visits, for the agencies. And again, these are the descriptions. Take a moment to review this when you download the public meeting PowerPoint after the meeting. And lastly, to keep current on the EVV home health care implementation, please refer to the Pennsylvania website. That's your source of truth. The link is there in the slides. Again, home health care services providers are strongly encouraged to request to be added to the EVV listserv by sending an email to rapwevvnotice@pa.gov, making sure to include the provider name and email. Again, these are your sources of truth. This is the way you get information. So please make sure if you're not on these lists, you are going out there and enrolling into all these listservs. Thank you. I think we're now handing it back over to Ellie.
Thanks, Paul. This is Janice again. We're going to go over some EVV personal care services reminders, as well as some EVV personal care service system updates. An update on the billing module. The Pennsylvania Department of Human Services will no longer deploy the free DHS EVV system billing module. If we were to use it, it would not submit the claim file to Promise. Users would have needed to export the claim file and import it into their own billing software or use BES. It was limited to generating fee-for-service claim files. And the module was unable to generate claims for managed care organizations. If ODP or OLTL providers had only a 9-digit MPI in HCSIS, it would only be available for the lowest active service location. So other service locations for that MPI would have required manual correction of the generated claim file. It required the use of the scheduling module, which is currently an optional module. It was required to have authorizations for all services being billed, and it required providers to go through the billing module training. So the billing module basically would not have been very provider friendly for PADHS users and would have had multiple constraints and limitations. The billing module would have been limited for use to providers who are using the free PADHS EVV system. The provider would need to use the scheduling module within the free Pennsylvania DHS EVV system. And this becomes required if they intend to use the billing module. The provider would need to have authorizations for all services being billed. If it's not required by PADHS, they would need to create a manual authorization in SANDATA EVV. The provider would need to go through a billing module training, at a minimum, the 2-hour self-paced online training. Who are creating a claim for PADHS fee-for-service are not able to create a claim for managed care. And with the purpose of creating electronic 837 files or a paper CMS 1500 claim form, which would need to be submitted by the provider, example via BES or other private billing software capable of ingesting an externally created 837 file. This module solely would generate the file or form, but it doesn't actually submit the file to Promise or Pennsylvania DHS for processing. SANDATA does not serve as a clearinghouse, and therefore we have decided not to go with the billing module at this time. Next slide. SANDATA releases. The SANDATA release schedule has been made available on the Pennsylvania DHS EVV webpage under the EVV implementation updates header of the personal care services page. And there's a little snapshot of it here on the presentation. SANDATA communicates by email to provider agencies when staff need to log out during systems outages. So providers should review notifications prior to releases and then inform their staff when they will need to be logged out of the system. The SANDATA customer care portal is accessible to find the release notes and can be found at sandata.zendesk.com/HC/EN-US. Next slide. SANDATA Mobile Connect, which is mobile visit verification. Those users must have GPS enabled for the visit to capture. Now, SANDATA Mobile Connect will not allow visit capture to occur without the GPS being enabled. GPS is required as part of the mobile application in order to provide location when clocking in as well as clocking out. The visit will not be considered verified unless the location or GPS information is there. So this is very important. Next slide. Some SANdata Mobile Connect reminders. Providers who are using the Pennsylvania DHS EVV system should remind their direct care workers to update the SANdata Mobile Connect or SMC application following a SANdata mobile application release. Staff must communicate with their administrators on issues with SMC and/or telephonic visit verification or TVV. Administrators should reach out to the Provider Assistance Center or PAC only when they cannot find the resolution to SMC password resets. And it is highly suggested that all agencies using the DHS EVV system have at least 2 EVV administrators in their employ in the potential event of the primary administrator's unavailability. Next slide. ODP fee-for-service providers will need to reach out to their supports coordinators to ensure the program diagnosis code is stored in HCSIS for that individual. This enables the DHS EVV system to automatically receive client updates. HCSIS authorization files will need the diagnosis code to upload into the Pennsylvania DHS EVV system, or errors may occur. The program diagnosis code is now a required field for newly created individual support plans in HCSIS for ODP and individual service plans in HCSIS for OLTL. This update ensures the HCSIS authorization data will be loaded timely into the DHS EVV aggregator. Next slide. Some PCS updates. A T1019 system notice has been shared with the managed care organizations, and an MA bulletin has been issued. Encounters which are posting ESC 927 or ESC 928 are now setting in a denial disposition for community health choices for dates of service on or after January 1st, 2022. Systems Notice SYS 2021-012, titled CHC ESC Disposition Update, was previously issued related to this. Encounters posting ESC 927 and ESC 928 for dates of service on and after June 1st of 2022 for physical health will set in a denied disposition. And Systems Notice SYS 2022-006 was issued previously related to this. Next slide.
Janice, I apologize. I apologize,
Go ahead,
Janice. Could we go back to the previous slide for a second? I apologize. So there had since been an updated systems notice generated pertaining to the physical health choices, EVV error status codes on the denial disposition being postponed to a forthcoming date based upon some testing that's been occurring with the vendors supporting physical health choices. So there will be a new systems notice issued with a specific date once that has been determined. So I apologize that that systems notice has been amended and reflected that it is no longer going forward with the June 1st date, and it is a to be determined date, which will be issued via formal communications from the Bureau of Data and Claims Management MCO support team. Thank you.
Okay, thank you for that update, Janelle. SANdata is working on updates to the DHS EVV system in the DHS aggregator to incorporate the PA DHS updates targeted for August 10th of 2022. No actions are needed by users other than additional training mentioned previously. DHS EVV system users should expect SANdata to include updates made to support home healthcare services in the release targeted for August 10th of 2022. So personal care service providers who are using alternate EVV will need to ensure visit records adhere to the updated technical specifications that are provided on the DHS website for supporting claims and encounters submitted after August 10th of 2022. Otherwise, the claims and encounters will deny. Okay, and back to Sandita.
Thank you, Janice. Can you all hear me? All right. So I'm going to go off script real briefly to go back to a question that was asked about the DHS free EVV system. PCS provider agencies that are using the free DHS EVV system were asking if they need to take the training that's coming up. And the answer is no, you do not need to take the training. However, it would be good practice to, when the supplemental guide is published in approximately a couple more weeks in August, to review that supplemental guide, to take a look at it, to see if there's any updates or changes that might be relative to your agency, and then maybe go into Data on Demand and review some of those webinar videos that we had for home healthcare training. So again, you do not need to take the training. However, it would be good practice to review the supplemental guide as well as some of the videos on demand in Data on Demand. So moving forward, I'll go now talk about alt EVV tips. So again, we're going to talk a little bit about why my visits get rejected. This is visits getting rejected when you're sending them to the aggregator. This is not the claims themselves. This is the visits. Some of the most common things that we see are client not found, and what happens is that the client was sent to us and they were not either in the client file, or you were sending visits to us and you didn't send it to us in your client file. So again, there are three files that alt EVV vendors send to us: a client file, or also known as a member file, an employee file, which is your caregiver's names, as well as then the visit file. And if you send your visit file before you send that client file, you will receive some rejections because of that. A visit date out of range: the visit is older than the account creation. Sometimes vendor accounts are created brand new, and that's going to happen in this case for home health care. Make sure that when you're sending your visits, you're not sending visits that were previous. So if you're a new agency and you started EVV services in July and you try to send visits all the way back to January, please advise the Sandata team so that they make sure that your effective date reflects that you are going to be able to send visits starting in January. So if your effective date was July and you send them for January, those will be rejected. But we can correct that. We just need to know. Worker not found, similar to the situation that I mentioned before with the client not found, where that file, where that worker was not sent to us in a previous file by the vendor. And of course, that'll then result in a worker not found. Schedules past due. Again, if you try to make an update to your schedule in the past, you will get that rejection as well too. The rows not found, trying to update or delete a record that doesn't exist. And that usually happens when somebody goes in and deletes a record and then tries to do it again later on. And then hours exceed the maximum hours allowed. Visit sent is more than 24 hours. And actually, the system allows up to 25 hours. So if your agencies, or your caregivers do clock in or out, a couple minutes before and a couple minutes after the hour, and it equals to 24:05 for those minutes, that's going to be accepted. But up to 25 hours, then it will start rejecting. Visit date is empty, and then the version number is duplicated or is older than the current. So there's version numbers, there's version records in those files that you send to us. And if it's a duplicated number or it's out of date, that'll get rejected as well too. Okay, moving on, please. So claim validation troubleshooting guide. This is a PowerPoint that I try to make reference to on every single one of our public meetings. This is a good guide. Pennsylvania has published this. This is one that will help you troubleshoot anytime you have a claim issue. So if you get a claim denial, please take a look at that link, go to that page, download that PDF document, and review that document. It'll go through the different ESC items, the ESC 928, the ESC 927, and help you troubleshoot some of the issues on your own. So you may not need to open up a support ticket after all, because you may have found the issue yourself. Next slide, please. Provider resources. So provider resources, SANdata, Zendesk.com, that's the customer care portal. Again, that's a good practice to enroll if you're not in the customer care portal. It's a good tool to have because we have not only ticket access in there to see all your support tickets, it's also a place where you can go to a knowledge center to be able to see this knowledge center and read about release notes, to read about any type of upcoming items that may be important to your agency from the SANdata perspective. There's also links to the videos for training and purposes and so on. There's the SANdata EVV training library that's also available for most of the videos on there are for the DHS EVV SANdata users. The SANdata learning management system for administrators only. And then of course there's the DHS EVV webpage, which I always call the source of truth. If you're looking for something, always check the DHS EVV webpage first. Review the webpage for anything you need, and it also will link you to a lot of these other links that are provided in this slide. So the SANdata EVV customer portal, again, as I mentioned before, there's two parts of the customer portal. There's the knowledge center, and then there's the ticket portal. In the ticket portal, I'll go to the right side first. It's going to allow you to review all your tickets in one place. You can update those tickets, and then you can also submit new ticket requests. The Knowledge Center has a lot of helpful tips, so getting started tips, answers commonly asked, or FAQs, links to the state web pages. So all, not just the Pennsylvania website. If you work in multiple states, you can actually get to a different state's web page if you need to. The welcome kit information, it's going to have user guides, training videos, and then of course release notes. If you're not enrolled in it or you're not sure, click on the link of sandata.zendesk.com and it'll ask for your password. If you know the password, put it in there. If not, click the forgot password on there, and then it'll reset a password for you or tell you that your email is not known. And then if your email is not known, then you can just register for the system. All right, and now I think it's on to Ellie this time.
Yes, thank you. We're going to talk about the EVV Personal Care Services Manual Edit Compliance. DHS is assessing EVV manual edit compliance for fee-for-service at this time. DHS is assessing manual edit compliance rates by program payer, whether it's ODP, OLTL, and OMAP. As a reminder, providers are expected to achieve at least 50% of EVV records for verified visits without manual edits. If an EVV visit is missing information, or the EVV visit information was entered incorrectly and requires any type of edit or correction, this is deemed a manual edit. If a provider manipulates data or adds missing data or changes data in any way after the service is delivered, this is deemed a manual edit. Other examples of manual edits include, but are not limited to, the following. A caregiver misses a clock in or clock out, and the visit needs to be edited to add the appropriate time of service. Or the visit is unable to be electronically captured at the point of care because the mobile application or telephony are not available. The EVV system is down, for example. The visit is unable to be electronically captured because a device cannot be used at the point of care. A visit is captured electronically but causes an exception to be generated. The record would be classified as a manual edit. The department is performing targeted outreach to provide technical assistance to providers that have either not submitted EVV data or have a high percentage of manual visits. Providers should self-monitor the EVV compliance and work to improve areas of non-compliance. DHS Bureau of Program Integrity is monitoring the EVV data. To ensure DHS can appropriately contact providers, please make sure legal entity information, including contact information, is up to date and correct in all DHS systems. DHS will be reducing the manual edit compliance rate threshold in the future. DHS is developing an updated MA bulletin to reflect the new manual edit compliance rates. DHS has developed a user-friendly EVV compliance report, which will be available in the DHS EVV aggregator portal and free DHS systems EVV provider portal for providers to efficiently determine their quarterly compliance percentage. The EVV compliance report is targeted to be promoted to production on June 30th, 2022, and PADHS will distribute communication confirming once the report is available. And if you look at this slide, you'll see an example of what the EVV compliance report would look like. And for the next section, we'll continue with Colby.
Hi, everybody. Can you hear me?
Yes.
Yes, we can hear you.
Okay, great. All right. Hi, everybody. My name is Colby Hasfurther. I'm a Senior Client Success Manager with HHA. I just wanted to give a few updates, especially regarding some of the recent changes we've made for EDI providers. So, next slide. So the next few slides, as I mentioned, apply to all providers who are using a third-party EVV system with members that are going through HHA Exchange for the CHC and Physical Health Choices MCOs. There were two changes that went into effect on May 23rd for the HHA Exchange integration. And the first of those changes is that the visit start time and the visit end time must match the EVV start time and EVV end time. Otherwise, a visit edit and action taken is required to be sent. Many of the third-party providers that we noticed had been rounding the visit times individually at the start and end times, which is technically incorrect for rounding rules. It should be rounded for the entire duration of the visit. So we're asking that those visit times not be rounded anymore. If there are true edits, though, to the time, that's perfectly okay. But in this case, there just needs to be a visit edit and action taken sent along with that visit. And then on the slide here, we have listed a common misconception that we've seen from some agencies who are trying to understand the change. And the misconception is that the caregiver must clock in and out right on the schedule time. But we want to clarify that what we're looking for is that the visit times are just not rounded. For example, if the caregiver clocks in for a shift at 9:02 a.m. using EVV, then the visit time that's sent to us should also be 9:02. And for the MCOs that allow billing through HHA Exchange, your visits will be rounded based on the entire duration of the visit when the invoice is created in the HHA system. Next slide. The second change that was made on May 23rd is the requirement for the EVV times to be split for overnight shifts. The MCOs do require the shifts to be split at midnight for 15-minute codes already. So most providers are already splitting their shifts at midnight as far as the visit times. However, if the EVV time is not also split, then SANdata will view this as a duplicate in the aggregator when we send that visit data, and it will end up denying the encounters for that case. So to avoid those downstream denials, providers are being asked to split the EVV time at midnight as well. The example that we've got shown on the screen is what will no longer be allowed to be imported And as you can see here, the visit times are split at midnight, these two separate shifts. However, the EVV times are exactly the same, spanning the entire duration of the two shifts. So that won't be accepted any longer. The EVV out time for the first shift will need to be midnight, and then the EVV in time for the second shift will need to be midnight. This slide is also related to EDI providers. We are asking that all EDI vendors transition to our V5 version 5 specification by July 1st, but it will be required no later than August 10th. And just to be clear, this is separate than the SANDATA recertification, but the updates do go hand in hand with their new requirements, which is why the requirement for the V5 specification falls at the same time frame. And there are some benefits listed here related to V5 that I'll just go through quickly. Rebilling is going to be enabled through the interface if you're using V5. So for providers who bill, who have to send their billing through HHA, typically you've been logging into the system to complete rebilling steps when you need to send an adjusted claim. But if your vendor is capable of sending us the rebilling information through the interface, that will be allowed on the V5 specification so that you don't need to log into HHA to complete your rebilling. The second benefit is compliance with the aggregator requirements, as I mentioned, that are going into effect on August 10th. There is a new field that is on the V5 specification that doesn't exist on V4. And that field is the tag for home or community for the service location. And that will be required by SANDATA in the aggregation data that HHA will send. So that does need to be on your file so that we can transmit that. Otherwise, those visits will reject. So that's a big one. And then the last benefit is that for the vendors, they're able to just maintain one specification across all the providers they service, which helps for efficiency. We did start to communicate this in January through the system notifications. And as a note, for any of the system changes that HHA Exchange makes, we utilize those system notifications and give at least 60 to 90 days in advance. But for something like this with a specification change, we started communicating that in January. Right, and then one other question that we've been getting frequently is where can I find my EVV compliance with the MCOs? And for all providers, those using the full enterprise, the limited system, or are an EDI provider, in your portal there is a section under report. There's EVV exceptions, and then there's about 5 reports that are available that cover EVV compliance with the MCOs. And the exception summary by provider, that one is great for just seeing an overall percentage per MCO. And then there's also this exception by caregiver, which we showed a little snapshot of on the screen. That's great for locating any caregivers that you may need to target for additional training to help bring up your compliance percentages. Right, and I'll turn it back over.
Thanks,
All
Colby.
right.
So I know that
Colby-
we are definitely over in time. Go ahead, Janelle.
I'm so sorry. I wanted to just ask if we have an opportunity to ask HHA some of the questions specifically directed to them from the chat.
Sure.
Okay, so Colby, if you're able to answer these, is what we're hearing from our stakeholders on the call. They're asking, does HHA change only apply for encounter visits?
So these changes apply for any agency that utilizes a third-party system that is flowing through HHA Exchange. So if you have members with the CHC MCOs or the Physical Health Choices MCOs that are in HHA Exchange, those changes would apply to any of those providers.
Next question that we have is related to slide 72. If you need to go back to reference it, does this mean DHS, SANDATA, HHA Exchange are requiring caregivers to clock in and out at midnight in the middle of a shift?
So no, you can choose to either do it that way, or if the vendor is able to just code that midnight clock in and out on the transmission, then that is acceptable as well.
All right, next question I have is the hours the client is authorized for will be used up quickly. For example, we have a client that is 63 hours based upon the EVV billed 7.34 hours. The CG consistently forgets to sign out, so caregiver. We can currently only submit what is allowed for the client. This will be a problem going forward. Is there anything you have to say on that one? It doesn't sound like a question, I apologize.
Yeah, that's okay. I think I understand where they're coming from. So if your caregiver clocks out late or clocks in late and that needs to be adjusted, you can still send an adjusted visit time. The visit time does not have to match if you adjusted it. We will just require a visit edit reason and action taken. So that's the caveat there, is that manual edits are still allowed when they happen. We just need to have a visit edit reason and action taken.
Okay, thank you. And the next one I'm seeing, that's a question, is if the vendor codes the over midnight transition, do we have to mark it as a manual edit, or can we use the geolocation that exists from check-in, or do we have to capture a geolocation at midnight to automate the split?
Yeah, you can use the same geolocation if that's the case, or same call-in number. Yep.
And I don't know if this is a question to HHA. If it is, if you know it is, Colby, please chime in. I'm seeing for DHS personal care services manual edits, why is there no leeway for signing into the systems? If a schedule is from 9 to 5 and the care worker clocks in at 9:01 a.m., it kicks out as an error. Is this something that you've observed in HHA?
I have not, but what I mentioned in maybe the first slide, this could be related, is that we are not saying that the caregiver needs to clock in right at 9 o'clock. If they clock in at 9:01, and if this is somebody who's asking about the EDI transmission, if they clock in at 9:01, the EVV time would be 9:01, and we would just want the visit time to reflect 9:01 as well. I mentioned a lot of folks, we've seen rounding on the visit start and end time, so it'll say 9 o'clock for the visit start time and 9:01 for the EVV time, and that's what we're trying to prevent. So should just be the same visit start time and end time if there's no manual edit. I mean, visit start time and EVV time, excuse me. There's no manual edit.
Thank you, Colby. Those are the only questions I've seen specifically directed to HHA at this time. Thank you.
Okay, you're welcome.
Okay, and I'm just going to wrap things up. We do have a few of the contacts that we have shared in the past. All that information is available in the slide deck and also on the DHS EVV website. And just a reminder that we do have 2 additional public meetings that have been scheduled for 2022. The next one is scheduled for September 23rd from 1 to 2. And then the last one for this year would be December 9th from 1 to 2. The registration links are available on the DHS EVV website. We have a snapshot here that includes that information. So you should be able to find it pretty easily on the public meeting page of the EVV website. And with that, we're going to wrap it up. Thank you, everyone, for participating. And sorry that we went a little long today, but appreciate everyone's participation.